Sometimes you hear that recovery can feel like it's slowed down, and you hear the term plateau being thrown out there. A lot of the people who I interview are overseas in the United States, but even people in Australia here, is a word, plateau is a word that's used by insurance companies to kind of say, we don't need to support you anymore. You're not going to improve further. What are some of the things that help people keep going through those flat spots of recovery? Because if any time can feel like progress is not being made, the plateau really kind of does test people and tests their resolve.
Yeah. Plateau. I really dislike the word plateau, and we've just decided we don't use it in our clinic. It's not a word that is encouraging in any way. It doesn't give any sort of visual hope. When you think of a plateau, you're thinking of some like desert flat sort of surface that's not going anywhere. There's a multitude of reasons. I think it's an outdated word. I think it started when we knew a lot less about neuroplasticity than what we do now. And I think it also comes from the hospital system. And I've used this word before. I started my career in the hospital system, and it's something that we would use to tell people perhaps it's time for discharge now. When you first had your stroke, we saw lots and lots of spontaneous recovery and then hardened recovery. And look how well you're doing now. But, of the past however many weeks, it seems to have plateaued. So maybe it's time to discharge. And then, sometimes that might be accompanied by a statement like, some of the research tells us that people make the most gains in their first 6 months or whatever. And so this is not information that, I think is overly relevant or instills much hope in people. And I think the language that we use as professionals is so important. And I think the language that we use should promote more encouragement. And there's nothing wrong with hope as long as it's, as long as we're not really giving people false hope, which whether that exists or not, I'm not sure. But I think the biggest learning that I've had as a therapist is moving out of the acute or subacute rehab in the inpatient setting and working in a community clinic, because it's just made me throw that word right out the window. From, the minute that I started working with people in the chronic stage or who have now been discharged from hospital, it just opened my mind so much. I mean, once people leave the hospital, there's certainly no plateau. The gains continue. And if you're feeling like you're stuck somewhere where you're not improving, maybe it's time to try a different therapy or try a different approach. Or it's like one of our clients said in here the other day, which was a beautiful quote. He said, "Don't change the goal, change the plan."